Meanwhile, deadline is approaching for Idahoans trying to buy 2026 health insurance on the state exchange. Idaho has the earliest open enrollment period in the country. Starts on October 15th and only goes to December 15th. Beyond that, unless you have a major life event, insurance marketplaces, well, they'll close until next year. The cycle has been stressful for Idahoans that use that exchange. Many are seeing prices go up way beyond what they paid in recent years. The enhanced tax credits from the Affordable Care Act are set to expire at the end of the year. Of course, that's unless Congress does something about that. But something at this point seems rather unlikely. Joe Paris spoke with Idaho Health Exchange about the looming changes and what Idahoans can do about it.
Less than 2 weeks for Idahoans to enroll in health insurance for 2026 on the State Health Exchange, a looming task for families figuring out finances.
Your Health Idaho is Idaho's health insurance marketplace. It's the only place where you can apply for and receive a tax credit, can lower the cost of your monthly premiums.
Pat Kelly is the executive director of Your Health Idaho, the exchange more than 135,000 Idahoans use to get insurance.
Someone who does not have affordable employer-sponsored coverage or another federal program that they're eligible for. So think about Medicaid or Medicare or TRICARE for veterans. So if you're not eligible for one of those programs, you might be eligible for a tax credit and enroll with Your Health Idaho.
With the expiration of enhanced tax credits in the Affordable Care Act, the cost of insurance can be dramatically different.
We've seen people who have five-figure increases, think $10,000, $15,000, $20,000 a year, and others that maybe see an increase of $50 a month. Most people are surprised by the increases, to be honest.
My name's Bob McMichael. I am a retired school teacher and professor, and I live in a rural town called Council.
We spoke with Bob a few weeks back, and he is one of thousands of Idahoans who saw what can be described as scary change.
If the tax credits do get taken away, the annual cost of the plan that we are on will be almost $27,000.
Bob says he and his wife fall into the category of senior citizens on fixed income, something he thought he would never say. A couple in a tough spot.
Our increase in our premium is going to be almost 800%, even if they reinstate the tax credits or if they are still on the table for us in 2026. It's going to be hard, but if they don't reinstate them, then we simply won't be able to afford any health care at all.
They aren't alone. It's leading to tough decisions.
And what we're seeing is a lot of people changing plans this year so that they can find one that really works best for their budget and, of course, their medical needs.
But those going through Your Health Idaho do have access to free help.
We also have over 1,000 agents and brokers all across the state, free to use, and they're experts in health insurance. Licensed by the state of Idaho, certified by Your Health Idaho, and again, experts in your community, no cost to use.
Those experts can help clarify a confusing conversation, like if all tax credits are just going away for health insurance.
People call and say, oh my gosh, all of the tax credits are going away. And that's just not true. The tax credits that are expiring at the end of 2025 are the enhanced tax credits only. The tax credits that can reduce the cost of your monthly premium are still available and will continue to be so in 2026 and beyond.
What advice would you have to Idahoans that are just hoping that something changes with the enhanced tax credits?
Well, I hope something changes as well, and my advice would be really two things. Make a decision now based on the information that we have in our system and in your account. Really important to have coverage for 2026. If the enhanced tax credits are extended or Congress acts in another way, we will make sure that Idahoans have every opportunity to take advantage of every bit of savings they're eligible for.
And Your Health Idaho also wants communities across the state to know that they have pop-up events until December 15th. Brian, you can go to Your Health Idaho's website, and they have a schedule of events in different communities. Okay. We know that sometimes there's a barrier of getting on the phone, trying to connect with someone and get it going, even if it's free. There will be people in communities that you can talk to one-on-one. Okay. And it's not manipulating, but they know how to work through the system to help families save money and not just get affordable health insurance, but insurance that'll be meaningful for their family's needs.
Mr. Kelly answered my question that I had at the end of that story there, saying that if they do change, if Congress does make the adjustments, then he'll make sure that Idahoans are able to access that.
Absolutely.
But have we heard from our lawmakers, our delegation to Congress? Are they planning on doing this, or what is their stance on when it comes to these changes, if possible?
We've seen that our delegation has celebrated the fiscal cuts and the health care cuts in the One Big Beautiful Bill. We have talked with them about affordable health care. My last conversation with Representative Russ Fulcher says he wants to make health care more affordable, and he actually introduced today a piece of legislation in Congress for short-term insurance. But the conversation is not concrete across all of Congress right now. We know that Speaker Mike Johnson in the United States House, he wants to have a vote possibly on this.
Sure.
But it's not scheduled, and it takes time to get things done. So we will see.
All right, we will see. Thanks, Joe.